Good afternoon, everyone. My name is Drusella Wright. On behalf of the Caribbean School of Medical Sciences, Jamaica, I would like to warmly welcome you all, including those joining us online and those who are here with us in person. A special welcome to our guest speaker, Dr. Neville Ballin, our Executive Dean, Dr. Neville Graham, founder of CSMSJ, and our current Chief Development and Finance Officer. Ms. Daniela Hadley, our registrar, along with our faculty, administrative staff, students, family, and friends. We are truly pleased to have you all here with us today. CSMSJ has been conducting a series of monthly public lectures since last year, and today we present another lecture in that series. Last month, we were privileged to have Dr. Neville Graham, who presented us with the topic, the philosophy of the acquisition of knowledge in medicine. Today, we look forward to another one of our lectures as Dr. Ballin presents us on the impact of chronic pain and non-communicable disease. We anticipate a very informative and thought-provoking session. At this time, introducing our guest speaker is one of our very own colleagues, a member of the CSMSJ family, Mr. Jackson.
Hi, good afternoon, everyone. Those who are here and those who are joining us online. I will be undertaking Dr. Neville Ballin's biography. Dr. Neville Ballin is the Executive Dean of the Caribbean School of Medical Sciences and a respected physician with decades of experience in anesthesia, intensive care, and pain management. A native of St. Thomas, Jamaica, he has dedicated his career to advance in medical practice, education, and healthcare development across Jamaica and the wider Caribbean. His work reflects a strong commitment to both clinical excellence and medical training. Dr. Ballin completed his undergraduate medical training at the University of Aberdeen in Scotland, United Kingdom. He later pursued postgraduate training in anesthetics, intensive care, and pain management in several hospitals across the UK. In 1980, he earned a postgraduate fellowship in anesthesia, further strengthening his expertise in critical care and pain management. Throughout his career, he has held several academic and clinical leadership roles. These include adjunct professor at the University of Technology, and lecturer and associate lecturer in anesthesia and intensive care at the University of the West Indies. He also served as a senior government anesthetist with the Ministry of Health in Jamaica and as a clinical director of the intensive care unit at the Kingston Public Hospital. Dr. Ballin has contributed significantly to healthcare development and training in the region. He helped oversee national practices in anesthesia, intensive care, and pain management, and coordinated the development of the postgraduate anesthesia program in the Bahamas between 1988 and 1991. He also helped develop the intensive care unit and chronic pain management clinic at the Kingston Public Hospital. For more than 30 years, he has provided voluntary medical service to inner city communities, demonstrating a strong commitment to public health and community care. Ladies and gentlemen, faculty and staff, please help me introduce Dr. Neville Ballin.
It's my privilege to be asked to give this lecture to everyone, those present here and those present online. I hope that the talk I will give some thought in terms of open some eyes and open some doors to those persons who are suffering chronic pain. Because what I really want to do today is to look at the impact of chronic pain as a non-communicable disease. Because usually when people speak about pain, they think of, you get an injury, get a pain, you have a surgery, you have an injury. Or if you have a motor vehicle accident, that's it. I want us to understand here today that pain as a process, as an insult, goes a long way and is far reaching. Okay. The objective of what I want to get through today, the next slide, is that we want to look at the definition of pain. Review the definition of the NCDs, non-communicable diseases, an overview of the impact, and look at some of the okay. Next slide. Next. What the definition of pain? An unpleasant sensory emotional experience, which is characterized by or described in those terms. It is subjective. There's no neurophysiology, there's no way you can measure pain to say that this is what pain is. So the 2020, the International Association of Pain, they went and changed the definition, upgraded definitions. Next slide. The definition is now an unpleasant sensory emotional experience associated with or resembling that associated with actual or potential tissue damage. Remember, unpleasant sensory emotion associated with, so the person does not have to have an actual injury or resembling that. And is expanded upon by 6 other keynotes. Next, please. It's always a personal experience. And it's influenced to a varying degree by biological, psychological, and social factors. Pain and nociception are different phenomena. Pain cannot be inferred solely by activity, the sensory neurons. Right? You can't assume that it's because of action in the sensory neurons that there's pain. And through people's life experiences and individuals, you learn the concept of pain. So it's a learned concept as well. So that that's yours. Next one, please. A person reported pain, that's what it is. So a person said, I'm in pain, you're in pain. It's not for us to decide that they're not, or the pain is not bad. They determine what the pain is. Right? It's usually adaptable, so you can adapt it. And whatever description, and there's several behaviors what people have in order to describe what they feel. Very description. I had an interesting experience on Monday. I had a new patient, who hails from another continent. And when she said to me, Doc, the pain feels like a crocodile biting me. And I thought, look here, the crocodile here doesn't let go, it bites and don't let go. In Jamaica, we wouldn't talk about crocodile biting, but where that person came from, crocodiles are around, so they're associated deeply with the crocodiles. Next, please. All right, what is pain? A personal experience. This is a very summary. Pain and nociception, different phenomena. So nociception, you get a cut. You hit your finger with a hammer. Nociception. The pain experience and the nociceptive impulses are different. Right? Life experience of individuals that have learned concept of pain. A person reporting an experience, how they report the experience is their experience and it's their problem. Right? Although pain serves as an adaptive role, it has adverse effects on people's functions and psychological well-being. And the verbal expression and the behavior patterns are in keeping what pain really is. Next. I want to look at some mechanism. I'm not going to spend no time today to go into big physiology, but I want to look at a simple mechanism. So the idea is to look at how pain impacts persons. How does pain, mechanical mechanism of action, pain, stimulus, peripheral stimulus, those they enter the C fibers, transmit the pain. Inflammation from the tissue injury, such as AMP proteins, prostaglandins, macrophages, they cause to sensitize the nerve endings. The neurons that transmit the pain, they themselves move substance P, which again turns on messengers, which can start activate the immune cells. You have a positive feedback loop. And then if you look into the dorsal horn of the spinal cord, where things happen, and then you get changes. Next. There's a simple feedback loop. What we see there, you get a hot object, the finger, you get injury to the tissue, you get transmission down the spine, through the nerves in the forearm, to the dorsal horn of the spinal cord. It goes to the ventral horn, and you have the reflex to remove the hand. So that is what happens when you get immediate burn. That happens to you. And if we look at the next slide, we'll see how the pain perceptions. This one shows you get the injury in the hand, and it goes through the nerves, the C fibers, the glandular fibers, to the dorsal horn of the spinal cord. What happens now modulates, so it goes up the spinal cord through the ascending pathways into the cortical side, and that now you get some modulation. So what do we do with the pain? And so then they transmit it down the descending fibers, and then the action occurs. What does that mean, though, in terms of practicalities? If you're standing at the end of a cliff and ants bite you, you're going to stay still. Right? Because you're motivated. If you're going to jump too hard, you fall off the cliff. So you're motivated. That's what the brain does. That's what the brain stem does. They send fibers. Next slide, please. How do people describe pain? Look at all these things. Widespread, annoying, throbbing, it's tiring, it's tight, random. So when I'm interviewing a person who comes in with pain, these are all the sort of things I tell you. Now, when somebody comes to you, we're going to say to them, okay, there's something wrong with them. Why they're mad enough? Look at what happened there. What does it mean? Sharp, burning, pinprick, tension. But that's their description. That's what we say. That's what pain is. Next slide. What are some of the things that cause that sort of thing? We have the pain experience. We have basically the pathophysiological groups, nociceptive. And we've got the stimulation of those, what I showed you, that what you saw on that slide, and you've got the burn on the fingertips. So you've got the stimulation of the somatic nervous system, soft tissue, muscle, bone, that sort of thing. And we have the nociceptive, which is as a result of nerve tissue injury, which goes to the visceral, stomach, and the GI tracts. We get the dilatation, and you get difficult to describe, to localize that pain, cardiac pain, that is the visceral pain. Then with the next slide, we've got the neuropathic pain, which people tend to find in the previous one. Go back. We have the neuropathic pain. What again, that tends to be where you got the direct damage, you have damage to the nerve fiber. So you have issues with the neuropathic pain. And now, so you have, sorry, that's a bit out there. So you have the central nervous system, you've got a complex regional pain syndrome, where you got the burning and all the rest of it. So if a wind blows on you, so a breeze touches the skin, a close touch the skin, that's excruciating pain. Then down below, we see we have something called plastic pain. So what happens, you have nociception, where you get a cut, but the way the nerves respond now becomes totally altered. And so what happens there now, you've got sensitization occurs, where the stimulus, what stimulates the nerve fire is changed. And so the nerve, you get this stimulus sensitization occurs, so that person's all sorts of things happen, which describe some of the pain syndromes, they describe some of the pain syndromes, what you saw in the previous slides. Next one. Okay, we're looking at pain. I like to put it in this diagram because this context. So we've got the three sorts. We've got nociceptive pain, we've got neuropathic pain, then we've got nociplastic pain. But what can happen is that all of this gets mixed up together, so that in one person, there's no coexistence. So it becomes very difficult for them to experience and express themselves. Difficult because we're now dealing with peripheral nervous system, peripheral sensitization of the nervous system, and then we're dealing with central sensitization of the nervous system, whereby all other things happen. So we're dealing with now the autonomic nervous system, and similar. That's why we end up with other issues coming. So the pain now becomes chronic, and so you start to have issues with your autoimmune system. You have issues with your renal system, your cardiac system, because you've got this hyperdriving of your autonomic nervous system. Can you move on? This is just a slide showing what happens. The pain brings. So after a while, this happens. You look at the normal brain, the functional MRIs, and you see change in the brain. So it's not, instead pain is in the head. All pain is in the head. It's not because you're mad, it's in the head. So when people say to you, there's nothing wrong with this in your head, yeah, that's true, it is in my head. But you're not mad. Next thing, it's really. Next. Okay, let's look at this diagram here. What happens with unresolved pain? Look at what happens to you there. Depression, insomnia, loss of income, rising suicide, sexual dysfunction, burning activity that goes down, loss of income, families lost. So this is what happens with unresolved pain. But we're talking about pain as a non-clinical disease. Take out pain, put on diabetes, becomes severe, loss of income, depression, lack of sleep. So we look at the same body, the embodiment of what pain is and what it does to the system is constant. So the next one. I want to ask, this is a patient, Miss Scarlett. So she's going to do a presentation. I want to look at the impact of what I really want to do is to show how pain impacts persons' lives. So she's going to put up a PowerPoint, and she's also going to be online to discuss it. So as soon as it comes on, I want you just to see how she has come through her problems.
Hi, everybody. Good afternoon. I'm hoping you are able to hear me.
Yes,
Doc, are you here? Okay, great. All right. Hello for those who are in the audience and who are online. Thank you for taking the time for this. I won't be long. All right. So a lot of the things that Dr. Ballin spoke about just now are things that I go through. My name is Tanisha Scarlett, and I am a television producer. I started production in 2005, and I branched out about 9 years later and started my own company called Film Productions Limited, which of course is the owner of AgriViews that comes on TVJ. We would have been 10 years old now if we have not had to pause due to an accident that I had. I'm not sure if you're able to see my slideshow. I sent it. You're able to see my slideshow? No? I can't.
We're putting it on.
Okay, it's been put up now?
Yes.
Okay, good. There it is. Okay, great. So, right, the impact of chronic pain for me. So slide 2, please. All right, so right, I was saying I'm Tanisha Scarlett, a producer since 2005. So we can go to slide 3. All right, AgriViews is a television program that looks at everything agriculture. And of course, agriculture talks about food, and food is farming, which means my job entails writing, walking, driving, standing, typing, These are just some of the basic things that I need to do to complete a production. And the fact that I'm the owner of the business, of course, you know, there are other elements, which means editing, post-production, things like that, which means I have to sit up for long hours to edit or even to do treatments for my programs for each season. I have to drive for hours because the program was set that we are able to visit these farms or farmers or farm store owners across the island to highlight what it is that they do, as well as what are the resources that they need in relation to assistance, right, for their businesses to grow, for their farms to grow. So of course, for all of that to happen, I have to visit and scout these locations, visit these farmers, assess the farms. Of course, filming also requires standing, visual capture, audio tests, correcting issues on the location. I don't know if anybody in the audience has any idea of what a production entails. But when we go out there, all the things that you see on the screen, trust me, there are so many things behind the screen that we have to do and fix for it to happen. All right, so that was my life before my accident. Of course, slide 4 will tell you I had an elevator accident in 2017. Of course, I was on vacation after Denby, which is our Jamaica's biggest agriculture show. And after Denby 2017, I decided that I'm going to go with my family and get some rest. And of course, Rio Hotel's elevator fell with me. And after that happened, everything else decided to go wrong. These are the things, the medical versions of what happened to me. So my doc, you're going to have to help me with this one, because some of them I don't understand myself. I just know how to explain what happens. But I know that my C4, C5, C6, and C7, which is, of course, that area in my neck. So that part of, because that's one of the areas that I have a lot of pain or spasms. I have, as it says, I have spasms consistently. My L4, L5, I have a tear in my left shoulder. So that causes a lot of problems. Nerve pains, I sometimes feel like my shoulder is gonna fall out. Sometimes I feel like my fingers, it happened on my left side, so my fingers don't work sometimes, well, most days. I also have issues with my upper back, lower back, right? So of course, the effects of the injuries in slide number 5 is the constant daily pain to the upper and lower back, spasms in my shoulder and neck, headaches consistently, nerve pains. These nerve pains are my arms, my legs, the back of my legs. Doc can tell you what I have to go through when I come to him. I'm in a wheelchair most times. Of course, these cause high blood pressure as well, because pain in itself, you know, it affects other areas. Of course, there are other things. The PTSD that Doc spoke about is something I go through, because you know that 2017 to now that's what, 9 years. So imagine feeling pain 9 consistent years, and this is daily pain, right? That is really hard to deal with. And PTSD would come from the fact that I'm unable to do a lot of things. My life pretty much stopped when this accident happened. All right, it causes me to be in bed for sometimes weeks at a time, because whenever the pain starts, I just have to stay in my bed. And these pain triggers come from different things. It doesn't have to be anything major, because as you know, the spine is what keeps our body upright. And the fact that my spine is damaged so badly, and the area of the spine that is damaged, it controls a major part of my nerve and muscle for my entire body. So with that, there are some basic things that happens. And of course, one of the other effects is I have panic attacks continuously. Well, I am now on what is called sertraline, which helps with the panic attacks, but it doesn't mean that whenever I go near an elevator, it doesn't bother me, but I cannot go in one. If I even think of being inside one, I am going to have a massive panic attack. So traveling is a problem. Basic things that people take for granted, walking, traveling, driving, is just to go if I'm traveling from Jamaica to the US, or no matter how short the flight is a problem. If I know I have a event coming up in Suriname, and the flight time to Suriname is 32 hours travel time, and I had to give up the travel because I cannot manage it. All right, so that's just in a nutshell. Slide 6. Now, if you go to slide 6, you can just click on it and you'll see a little short video of just an idea of what I had to go through after the accident. I don't know if you're able to play it. Okay. Oh, all right. My presentation so finished. Just hold on. In a presentation every time it's finished, so finished. Yes, okay, so that is just a short video of me going to my physiotherapy session, being unable to walk, because what happened with the pain is that not only my upper body not being able to sit upright, but of course I have issues whenever the pain starts and spasms. Let me see if I can try to explain it. Whenever they start, it feels like if you go to the supermarket and you have a bag of 10 pounds in both of your hands. Think about having that bag for a minute, and then think about having that bag or what it feels like if you have that bag for 5 minutes consistently. That's literally what the spasms feels like in my upper body. So even though it's my upper back, neck and shoulder mainly that was damaged, what happens is there are other, what you call them now, domino effects where the body is concerned. So what happens is, of course, which causes me to be in that wheelchair, is that it shuts off my mode of movement. So whenever that happens and it gets to the point that I cannot move, I'm unable to do anything at all, go to the bathroom, simple things, right? And at that point, I was not even able to do things like comb my hair, just from the effects of the pain from that accident. All right, slide 7 now speaks a little more in depth to the injuries. So now I'm unable to walk for far or long distances. I cannot sit up for long periods. I have crippling pain that causes me to be in bed for weeks at a time, as I said earlier. Unable to interact with my children. I have 2 boys. And of course, my boys feels the effects of these pains from these accidents. And it is from just trying to play with them, things that I used to do, or my older son would have had experience with me playing football with him or going to the beach or things like that. Now, if I take my 3-year-old to the beach, my older son has to take him from me at intervals because I can't keep him in my hand for any long period. All right. So, one of the things I realize works now is that I have to get a floaty that I put him in, and that helps to reduce the whatever compression that would cause from having him in my arms. I'm unable to do house chores, things like washing, cooking. I don't clean, none at all. I need help to use the bathroom most days. So when I wake up in the morning, because I would have taken my medication, say for example, the last set I tried to take at 10, if I don't get up again and take, for example, the tramadol or I do mixtures sometimes, like Midocalm and Cetadine, sometimes just to try to relax the nerve. If I don't get up at probably 1 o'clock or 2 o'clock in the morning to take my medication, what happens is when I get up at probably at 5 to get my children ready for school, I cannot move, which means I have to get help to go to the bathroom. I have to get help to do things like even to brush my teeth. Sometimes I can't do that until I take medication, which of course, taking these medication on an empty stomach is another problem. But guess what? Without taking the medication, I won't have any relief at all to be able to be functional. And seeing Dr. Ballin over the last 9 years has assisted me just to be functional from my chronic pains, right? So that's what my pain medication helps me to do. So that gap in the medication causes that we call it now crippling effect where the remainder of my body is concerned. Of course, sometimes my 16-year-old, he goes to school close by, and there are times I have to call him from school, call his teachers to ask them to send him home or accompany him just to help me to come out of the bathroom. I cannot be alone anymore. And I'm 45 years old, and that in itself mentally is just, trust me, there are times I try to explain to persons, you know, how it's not only the physical part of it that you know, cause effects. I'm sorry, I'm getting a little emotional because of course this is just trying to relive some of the things I go through. But whenever I'm unable to just get up, knowing that my 16-year-old sometimes has to come home and help me to just clean me up because I couldn't move, so I had to do whatever I wanted to do in the bathroom right there in my bed or on the ground, because I tried moving and I fall on the ground or my phone dropped from me, or I have to keep my phone close by if I'm home alone. That's how bad these pains get. And when it's at that point, when I see that probably 3 days or 4 days, then I'd have to go to the doctor. Of course, you'll see a part of it there that speaks about my medication. Sometimes the medication is ineffective. Dr. Ballin, when I go, he has to give me injections or find other modes to assist me with these pains, because as I said, just to be functional is an issue for me every single day. I remember one of the hardest things when I had my son 3 years ago. Well, yeah, I had to give him up at 1 year as a baby until he was 1 year and 3 months, because of course the effects is I can't lift him, I can't cuddle him, I can't put him to bed, I can't feed him. He was not breastfed like my older son, because of course, again, just to hold him up, even with having a pillow, remember, you know, our muscles work. No matter what you have to do, you have to utilize the muscles in your body to do it. And again, this is my upper body. So trying to breastfeed my son was difficult. So I had to send him to his grandmother because I had to be taking so much pain medication. I'll fall asleep and I don't hear him crying. I was afraid that if something happens and him roll off the bed or something like that, because at this point he's a baby and his dad works, my son goes to school, his sister goes to school, there's nobody to assist. So I had to send him away because I had no other choice. Because again, the pains that I feel and the effects of these pains are so much that it was just unfair to him. And it is unfair to them even now. He's older, but they still can't do things like come and hug me certain way, because they will hurt somewhere. On slide number 8, you'll see a photo of one of my older son. And on there, I placed this photo there because I remember we were at the park and he came and he held me back ways. And even though I wanted to take a photo with him, nobody would understand. After taking that photo, I had to lay down in my bed for 3 consecutive days. My son could not touch me because everything on my left side was hurting so bad. My shoulder was swollen just because he came and he hugged me from behind with, you know, when your son will come and him jump on you, sort of a thing. That's what happened. And for 3 consecutive days, I could not get up out of my bed because of that. So just imagine what at the time, I think he was 7 years old when this photo was taken. And can just imagine what he had to go through at that point. He had to learn to cook on his own at that time, because there are days I can't get up out of the bed to look after anything for him to eat. He had to cook for me to eat because I can't do anything. Now the limitations they're just mounting. I can't work. I don't work anymore as I can. So of course my job as a television producer is pretty much no longer. If you go to my social media page and look 10 years before now and now, you will see the difference in my social media pages, because before now you would have seen how active I was. You would have seen me taking pictures, videos, posting. I don't do that anymore because of course I still suffer mentally from what I'm going through. And the pains, the other day, we're almost in 9 years of this accident, and the other day there was an event at Hope Gardens, and 3 hours into the event, I had to go and find the medics who had to give me an injection of morphine, and I don't remember what the other thing was that they gave me for pain. Because when I crossed the booth from the JSIF booth over to the medic, I could hardly walk. They literally had to put me in a chair, and when they saw that the chair was not working, they had to lift me to put me on one of the stretchers that was there. This was just 3 hours into the event, and mark you, I was not walking for the entire time, but just being upright was a problem. So now these limitations have cost me greatly, financially, emotionally, physically. It has messed up my children. Right now, my son has to be getting counseling, my 16-year-old, because he struggles. I remember having 2 episodes of, oh, Jesus. I tried suicide twice. And the second time, my son was the one who found me prior to them sending me to the hospital. And since that, he has been having challenges emotionally, and he has been taking it out at school, even at home sometimes. He tries to be brave in front of me, but whenever he goes out, because he has lost so much of his childhood, he is still trying to adjust. So when he goes to school, this adjustment phase takes so much out of him. The fact that I am now also a part of there's the disability sticker that is on my car. These are things that my children have to deal with. They go to school. If I have to go to a meeting and I have to wear a brace or a collar, sometimes I have to put myself through the pain just to ensure that nobody's teasing them at school, because I have to wear a collar. I have to have this big brace on my back. These students don't understand, but guess what? My son is going to be the one that suffers. Of course, there's so much more that I could share, but I think in a nutshell, I wanted to just show as much of what I have been going through and how it affects my life generally. I mean, even church, I don't go to church as often. I went to church 2 Sundays ago, and I spent the entire service laying down on the bench. So I just try to stay home, stay close to my bed, or if I go on the road, stay close to my vehicle where, if anything, I can recline, because the effects of the pain is just, sometimes it's hard to manage, or I don't think I manage very well. I just try to cope. I was hoping I could go in some of the things that I had to do outside of the pain medication, but I know it was just 10 minutes that I got, so I didn't want to go over the time. But of course, if there's any questions, you can send them to me and I will respond. Thanks again for the time, and I hope this helps you to understand from my experience what chronic pains can cause. Thanks.
That was certainly an insight into what chronic pain can do and how it affects that person's whole life and the family. It's no longer an issue of you as an individual, it's the families involved. I certainly, when I'm interviewing, I like to bring all the family, because it really makes a huge difference. The husbands, wives, kids come in and join, so we can talk about family. Pain is not an individual, it's a family problem. Okay, Mr. Simpson, next slide for me. I have to click on each one individually because it's that next slide. Because it's talking about what is established by research, what pain is. Next slide. Right, quality of life. Let's go through quickly. What it affects? Quality of life, ability to function, ADLs. Next one, we have to take outcomes of sector. Because Tanisha could explain that. The social consequences, the marital, family relationships, intimacy, social relationships. Next, the psychological morbidity, fear, and suffering. It is real. Which is going to talk about suicide. I've had several attempts in my practice. I've had one young guy, 28 years old, killed himself because he lost his body image. And it was so sad. Next one, the medical comorbidities, accidents, medication, you heard about it, immune functions, clinical depression, all comes out with the issue of pain. And then societal consequences, healthcare costs, society loses, lost work days. At the last, I'd like to bring this one in. Mismanaged chronic pain is often a personal, biopsychosocial catastrophe. It's a huge public health problem. Next. Why is pain a huge problem? Just very quickly with this one, we talk about the new technology, talk about AI, advances in technology. MRIs don't show pain. Okay, people tend to say, do MRI, doctor, show me everything. It doesn't do that. So that's partly what the issue is. Problem must be fixed. We have a problem must be fixed. If we've seen there, it can't be fixed because it involves so many different systems. Next one. Evidence-based medicine. We're going to this slide where we say that if we can't do a double-blind placebo-controlled study, it's not scientific. I'm sure you will have to listen to that last person with her problems. What double-blind trial could we do to prove that she has pain? Pain is not easy to study. Next. Right, just a question of the prevalence, quickly to show the Ballin. 50 million less than 2018 from the mobility mortality reports states. 50 million Americans, 20 to 30% of the public suffer from acute chronic pain, and 70% with advanced. Next. And this is just what we show here, what we're looking at here, in terms of the percentage of adults. You can see that we talk about high impact pain, where it affects you badly, like the last person who spoke, she has high impact pain. You can see females more than men, and females more than men, with the green and the blue and the purple slides. The high impact pain, which affects lives and everything, on the right, again, it's not as much as what happens with the chronic pain and mobility. But definitely, again, it's more high than it's still pretty high in terms of numbers. Next, the impact. I don't have to go through this because the last patient told you that it affects certain work activities as the high impact pain. Common reason why adults seek medical care. associated with decreased quality of life, opioid dependence, poor mental health. These are well documented figures. Next. What's the economic impact? Fantastic. People don't go to work. Absenteeism, presenteeism. Go to work, you lay down on the couch in the corner because you can't do anything. You have to work so you can get your pay. So what happens now that the productivity got way down. So when you look at the productivity cost, the loss of income from productivity to a nation is very, very high. Right, next. We can read that there. The last person really showed all of these things: capacity, disability, quitting the jobs, or unable to do the job. 7 times higher with person with chronic pain. So when people have an accident, we think, oh, so it's just a week, it's just a fall. We've seen some serious things, simple problems. Okay. Next slide. This will come up in the journal of pain from John Hopkins. Chronic pain, in that time, they estimated as high as 635 billion per year. And it costs more than cancer, heart disease, and diabetes. But because cancer and heart disease, everybody's worried about heart disease, they have cancer, everybody goes through it, but nobody thinks of what cost, what pain is causing. And so we don't put the research into it, we don't put resources into it. Next. And just a couple of quick slides to show some of the costing. Heart disease, 239 billion. Diabetes, 327. Next. Indirect cost in the UK, back pain, 5 billion, 10.5 billion in 1998. People with back pain. Problems, productivity losses, again, as a result of it. So, what I wanted all people will get across from this talk is that chronic pain is a major, major problem in terms of our productivity, in terms of the earning of a country. That is why more developed countries, they're pushing to get clinics so that people can be treated, or systems to treat them. Next slide. Now, the non-communicable diseases, because that's part of it. So why is it non-communicable disease? We know what these are, medical conditions that they're not caused by infections and can be passed on from one person to the other. Next. Just a quick thing about NCDs, typical non-infectious, long duration, functional impairment, and disability. Even what I said on the slide, I think the last patient described all of that. Everything what she said, long duration, functional impairment, disability, comorbidity, clustering, major health impact, she displayed all of those things. NCD, it fits a pattern. And so increasingly we need to look at it as a public health problem and not a need problem. So when we talk in Jamaica, when the health minister speaks about NCDs, we talk about heart disease or cancer and diabetes, we should be putting chronic pain into it. Because those of us who deal with persons today are seeing what it's doing to countries. Next. This has been said before, really, what they are long duration of case. Result of a combination of genetic and physiological and psychological, environmental, behavioral. Next slide. Okay, the World Health Organization, WHO, they put out these 3 things. I picked out these 3 things: unhealthy diet, physical inactivity, and tobacco use. Looking at tobacco use, but to go further on, the chronic pain patient will display both those things, unhealthy diet. Next, we know what the issue with unhealthy diet is, because even though we're talking about taxing sugar drinks, eating too much carbs, obesity, all the rest of it goes along with it. So we know the issue of that. But physical activity, surprisingly enough, is that it creates inactivity, it creates a lot of problems. And from the WHO in their surveys, that 25% of adults are actually insufficiently active. In other words, they're not able to do the things to be active to maintain normal health. And it recognizes as the 4th leading risk factor for global mortality, inactivity. What does chronic pain do? You see that lady, she's in a wheelchair, she's in bed for days. And inactivity, remember the World Health Organization figures that it's the 4th leading risk factor for global mortality, and it shows a critical role in public health worldwide. So we're looking at that in Jamaica, which we're looking at this. Next slide. In Jamaica, in 2015, 7 out of 10 Jamaicans died from 4 major NCDs: cancer, cardiovascular disease, diabetes, and chronic respiratory disease. That was the admission in 2018. So in terms of, we know that pain can cause an increase in deaths, and so we want to get, and so we look from the cardiovascular disease, the medication, the lower respiratory diseases, all of these are brought about directly from pain. Next slide. The Joint Commission for Standards of Pain Management. We could take that, next slide. We could take that out and take our pain management and put down any NCD we can think of. Patients have a right to appropriate assessment and management. Take out pain, put blood pressure, put anything you want. Pain, blood pressure needs to be assessed, documented, and followed for appropriate interventions. So any of the NCDs, this is where we can change anything, policy and procedures should support the appropriate use of the medications in anything. Patients and families should be educated. Discharge planning should include symptom management, how they manage symptoms. So at this point, though, I have another person. I asked her if I know what the 10 minutes ago. So I'm going to ask if Stacey, if you can come and give a short in terms of your journey with the chronic pain. I thought bringing the patients that would really hopefully bring it home to people what it does to persons. 2 different persons, 2 different problems.
Hi, good afternoon. Are you hearing me?
Yes. Let
Can
me
you
just start before. Well, she started with a prank. Somebody jumped on her back.
Can you see me as well?
Yeah.
Yes.
All right, good afternoon, everybody. I am Stacey Senior, and thank you, Dr. Ballin, for having me. I'm going to speak briefly, as Dr. Ballin asked me to, on my journey with chronic pain and how it has impacted my life physically and emotionally and financially. My journey started in 2006 after I fell down a flight of stairs. At that time, I thought it was pretty funny the way I fell down. Eventually, I was diagnosed at that time as having a whiplash injury and a strain in my ankle. That is after a couple of days of having constant pain and restricted movement. Now, at that time, I was a marketing officer and I managed a brand from the strategic and tactical level. And most of my job activities were physical. It meant I had to go to the agents and do promotional activities or corporate events. So being told that I have a whiplash injury, and also I had a neck brace and I had constant chronic pains, I couldn't go to work at that time. So it was quite challenging. And persons at that time thought, for that little job that we should get, she need time off from work. But that was the case. Eventually, things got better with therapy and medical treatment, and I went back to work. And I thought things were good. Then in 2007, I had another freak accident. And that, for me, was the beginning of what I thought was the end. I experienced a pain at a degree that I've never thought was possible. I had burning, constant, chronic pain all over. There were times I had a fever, and the doctors did everything possible to get me to a better quality of life during that period. But it was quite challenging because one of the issues I had, I was allergic to a number of the medications, plus my body would not respond very well to treatment. Eventually, they thought that it was best for me to stay home for 3 months because things got so bad where I couldn't move. I had a lot of swellings all over, and they thought it's best to have the doctors come to me at home. Fortunately, I was in a position where I could get that done. So the doctors came to my house and the physiotherapist came to my house, and I got the treatment that I needed. Despite being at home for 3 months, persons, because I've heard the term where people say, oh, she's at home for 3 months, she's on vacation. It was no walk in the park. Every day was a challenge. I barely survived. I never slept because my body was in constant agony. Eventually, with the help of my doctors, because I had a very good team of doctors, I went back to work, and things seemed as though, I was living my life as normal as possible. But then it got worse again. First, it fluctuated where there were days where I'd be off for about 2 days per week. One, because as you can imagine, with a job as a marketer, it would involve, as I said, I'd have to write business plans. I couldn't move my fingers anymore. My fingers were always swollen. And things got really bad. I couldn't sit for longer than 5 minutes. I had a fever most days, even though I didn't have the flu. I started experiencing memory lapses, and it was really bad. Eventually, Dr. Ballin and his team diagnosed me as suffering from chronic myofascial pain syndrome, chronic fibromyalgia with widespread long-term pain, chronic pain condition which cause long-term pain, also anxiety disorder, depression, and he thought at the time, because we were doing a number of treatment modalities and nothing was working, I was always swollen, I was always in pain. And Dr. Ballin said earlier that people think that your pain is in your head. When I spoke about my pain conditions, people thought, especially, your coworkers, because you're not able to function the way that you used to, they thought that you were making up things. Plus, there were days where, because I didn't lie about my pain, if I was having a good day, I'd enjoy my life the best that I could. And then when people saw that, they thought, but you were fine yesterday. So how is it that today you're saying you're sick? But then it was a battle for me because I was always fighting against myself. And eventually, Dr. Ballin thought that, because I've always done the MRIs and the blood tests, which would always show that the inflammation level in my body was very high. And they would always see the swellings in my body to show that, this is not something that I'm fabricating. While I know that you can cause your body to react a certain kind of ways. But at that time, because I was getting the right professional treatment, I had a psychiatrist because at one point things got so bad where I wasn't coping at all. So they knew that I wasn't perpetuating my situation. And Dr. Ballin thought it's best for me to stop working. And being at home, one would think that it would get better, but home was where the hurt was for me. Every single day, every minute of the day, 24 hours a day, I was in pain. I was unable to shower, bathe myself. I couldn't cook for myself anymore. I couldn't clean. I had toothache every day. I had extreme hypersensitivity. I couldn't keep on my clothes. I couldn't walk. At one point, I had to walk with a cane. I would fall in public frequently. I remember this incident. One day I was in the supermarket and I fell. And this man was like, she faint, she knock out, say she knock out, put on shoes over her nose. I was trying to tell them, you can't touch me. Because even the slightest touch at that point caused me pain. It just sent flare because I was always overly sensitive. And my life was like that all the time for over 12 years. I was given ketamine infusion at least once per month by Dr. Ballin. There were days that I would get up to 10 trigger point injections. I'd get these injections in my head, in the back arm, in my foot bottom, in my knee, in my vag, in my belly bottom, on my belly bottom, because I was just always in pain. I saw neurologists. I saw all the specialists that you could think of because nothing was working. And everybody wanted to help. At one point, I even went overseas to a pain clinic with the help of Dr. Ballin. And their evaluation came back that I was only functioning at 47%, which is very low. And for the average human being, I could barely walk at one point because most of my pain was concentrated to the left side of my body. So I would tip on the right side. So eventually I started walking lopsided. I had to teach myself how to walk again with the help of Dr. Ballin. So my life became burdensome. I became a burden to myself. I didn't like myself. I didn't go out anymore. I had a very social lifestyle before all of this happened. I had a good job. I had good friends, and I thought I was going places. And what hurt me the most in all of this, other than how I how my life changed, is how people viewed chronic pain, because it's an invisible process and they can't see it. They think that this must be something that this person is making up in their head. It can't be real. How can you be in pain all the time? And I've been told before that they're sick and tired of me. And I was saying to myself, it's not just you. I am also sick and tired of myself because I wish I could escape myself. But God's grace is sufficient. And Dr. Ballin has helped me to get to a stage where I learned how to take care of myself. When he saw that nothing was working, as I said before, I was in the hospital every single week at one point, and every single month I did infusions and a number of other modalities with physiotherapy and everything else. And he said to me one day, Stacey Senior, would you try something different? And I said, yes, I'm willing. Because at that point, I was taking 15 pills per day, and even that wasn't helping. And he said, I'm going to send you to this holistic guy, and we're going to try a new treatment. And I went on a new program where for 2 months, I went on a specific juicing diet. And that diet significantly changed my life. In fact, it was the beginning of a new journey for me. It involved anti-inflammatory juicing because, as you know, with fibromyalgia, our inflammation markers are always high. So that trigger pain and that trigger the fatigue. And having been on that program for 2 months, the first time I slept unaided, at that time it was 10 years, was after being on that program for 2 months. And then I realized that the swelling started going down. And with the swelling going down, Dr. Ballin was able to introduce new treatments in terms of, he'd say to me, Stacey, I'm going to teach you to take care of yourself. And he'd send me these literature, and I had difficulty reading because I couldn't process things anymore. So it meant being kinder to myself, because when I read a paragraph, I did not know what it was saying. Words like there, I remember specifically, there seemed like there. I couldn't read anymore. So learning to take care of myself in and of itself was another battle, because I had to understand what they were saying. So I had to find another way to learn. So I started listening to audio. And what I listened a lot was books on how my mind affects how my body perceives pain. Dr. Ballin taught me about real pain versus referred pain. He used to say to me, if you're feeling the pain in your hand, Stacey, you need to find the trigger. The trigger might be a neck. And he taught me how to identify the pain flare and also the trigger. So when a trigger starts, then I'd go back to, or even if I call Dr. Ballin, I said, Dr. Ballin, I'm having severe pain. And he said, what happened, Stacey? What did you do? And we can go back to see what triggered that. And I've learned over the years to find what causes me stress, manage my stress, manage my sleep. Sleep is still a challenge for me, but I do the best that I can. I still have issues with depression, but I still go to my psychiatrist periodically if I need to. I eat very well. Most times I go on a raw vegan diet. I've been raw vegan sometimes at one point for like 2 years. Specific clean vegan diet. I have to exercise at least 5 times per week. I find that if I don't move, then the pains and the muscles get tight and I have pains all the time. I brought myself back to being able to walk without cane with the help of Dr. Ballin and other persons, my family and friends. And I also brought myself to start living the life that I wanted to, with the exception of the career. I lost the career. That's the part I mourn about every day. I still can't do a 9 to 5. I don't do a 9 to 5 anymore. And that hurts a lot. When I thought things were getting better in 2019, I found out I had cancer, stage 3 nasopharyngeal cancer. That treatment journey triggered fibromyalgia again to another degree, because it, especially the radiation, it triggered the neuropathic system in my body. And again, with Dr. Ballin's help, I was able to endure cancer. And now I am 4 years cancer free, and God has been good to me. I've done a number of sleep studies because they really wanted to show the stem of the insomnia, and my sleep study results show that even with high doses of medication, I wasn't going into REM sleep, and it took a very long time for me to sleep. So I've done a number of treatment modalities, plus also evidence-based things that were done to determine that it's not Stacey that is pushing this pain, as people would say. But I'm thankful again that I am cancer-free, I manage the pain, and I do the best that I can. So my encouragement to everybody is that chronic pain does affect your life. It changes everything. It makes you want to cry. There are days you don't like being yourself. But if you do the things that are necessary, if you can, I'm not going to say it's easy because it's a very expensive process, and it's a process that requires you to have the right support, both from the professionals and your family and the right friends. If you have that, or even if you don't have that, there is research in almost in every space right now. I learn a lot from listening to a number of persons that speaks about how the brain functions and how my body functions, and I try as best as I can to adapt and adjust. So change is possible. Hope is alive, but we just have to keep trying. So thank you, Dr. Ballin, for all that you have done for me. And Tanisha, I pray that the Lord will continue to bless you and keep you, and may you find strength in this journey. Thank you.
So it's interesting. I think if one thing we've done today, I'm hoping that we've understood what the impact of pain is, and really what it has done, how it affects how it affects the non-communicable. That was the goal of this. It wasn't a matter of me doing a lot of her physiology and putting slides and stuff like that. So just for to finish this now, what's the management pathway? Discussion, empathy, understanding, counseling, very important. The psychiatrist, psychologist, exercise therapy here is extremely important. Posture management. And what are the pathways? The pathways to treatment. Hey, curving all diseases. Next one. What are the pathways? Well, I mentioned the goals already. If we want to do that, improve quality, job performance, family unit, prevent depression and suicide. Very important. It happens. Very prevalent. Next one. Next slide. Next slide. Alternative medicine. You heard Stacey eloquently spoke about that. Very important. Very important. Well, one of the things I used to do with her, she was really known. I used to say to her, every week I want a new outfit. And so she'd have to dress up at home, put on makeup and put on a dress. I got a picture of her going to her prom with her just to make her trying to feel good about herself. You know? The nutritional aspect of it, very important. Right? And obviously we do all the more involved in like infusion, injection and stuff like that. Next slide. Just want to bring up this to the next one, please. Next one. Listen to the next slide. Just a quickly, and there's a big crowd in this slide, the NICE pathway. The NICE is the UK system and a pathway for management of pain. And we can see there, you can look at the slide here, look at the alternatives, basic treatment, analgesics, and the steps that we can go through. So I won't go through those today, but there's a pathway we can look at in terms of seeing how can we achieve an objective. And the next slide, want to bring this as my final slide to everybody. I want to read it because it's very important. This came out of 2008 and it hasn't changed. Chronic disease pain becomes low on the political priority list, and chronic pain just gets forgotten. Burden for the sufferers and their families and society is substantial and merits better treatment. The mark of a gracious society is how it treats those with the least voice. That chronic pain puts people at the bottom of the pile is precisely why we should be agitated for their benefit, for a fair share of the medical resource league. So I want to leave it as I've done. That's very important. That came from McQuay and Health, and I think called the bottom of the pipe, the British Medical Journal. So, ladies and gentlemen, that's the end of the presentation. So we're open to any questions to me or to any of the patients who we heard on the presentation. So if anybody has any questions to ask, all the time.
Could you just elaborate on the role of posture management?
Yeah, posture management is very important because hold, stand, and sit. You could demonstrate if you can see that I always like to demonstrate this for patients. You know, when you're walking and you're bending, you're twisting.
Stand to the chair.
Yeah, you're standing here, and we're standing straight. No, when you start to lean like this, for you to stop from falling this way, you've got to start to contract all the muscles on this side, on the other side, on the opposite side. So what tends to happen now, you get spasms on this side, and you start to get a lot of pain, but your muscles now start to become contracted. And the same thing, if you're sitting in a chair and sit like this, this is very important. If you're sitting, you're sitting like this continuously. If you're just sitting forward continuously, when you get up, imagine when you get up, because this is the position you're in. When you get up, this is how you are. So you're in that. So you have to learn to when you're sitting, sit in that position. That's where to allow the lower back to be in a position, the muscles to be relaxed, and not turn to any side. So, in fact, a lot of patients come to me with upper body pain. And what I do, I tell them from the beginning, don't waste your time coming to me. I send them to one of my physiotherapists who I work with for posture management. After she worked with them, I said, if you have a problem after that, you can talk to more people to work proper alignment and posture. And it's the reflection versus so we talk about it. He said, if you sit like this, it's a problem.
What I find is that posture does come up.
No, it's one of the most important aspects of
It generally, people tend not to think.
I think, in all areas, it's very important.
I know.
Yes, sir.
I have a question about fibromyalgia. So talking about pain management.
Yes.
I want to know how common fibromyalgia really is in Jamaica. And what are the steps as the average person in Jamaica, was the doctor, is expected to follow as a means of reducing pain from. So since it's really hard to diagnose,
Well, the classical diagnosis from the Fibromyalgia Association are the 90 trigger points, and they're listed by further. But what I tend to find that the tender points and trigger points that people have, I've called it the fibromyalgia syndrome, where they're very tender from the myofacial inner stuff, and so they're active all the way through. Oh, and it is very complex. They have the injury. Part of it, I think, is also to talk about posture, so it starts with fascial conditions. One of the hallmark of treatment is exercise. And when you tell people to exercise, they say, well, it hurts. I say, well, it's a problem. You have to do it to stop the hurt. Because we can put you on medications that they don't really work to look, they're setting up the joint various types of groups to help. They don't really go to the core of the problem. The core, at the end of the day, even if I give you the medication, the answer is to exercise constantly. You heard the last day, they said 5 days a week. He doesn't exercise, all I must do is spice up the sticks, and that's what happens.
So a follow-up question, how related is that then to controlling generalized inflammation? So, for example, I know people depending on, for example, the type of foods that they consume, hypersensitivity to various things like that can result in some form of more diffuse inflammation,
Right.
around urinary issues that potentially lead to pressure on nerves and potential pain. So how does that relate to the exercise, the inflammation aspect?
Well, one of the things that we have to do is to look at the triggers. And one of the things I've started to do, but which I did not start, is to get people to test for food allergies. Surprisingly enough, that person go for allergies and their allergies are sensitive to food, right? And there are people up to 60, 75 of food sensitive to food. And I'm tested using some of these electrodes on the skin test, and they seem to correlate once a certain level. And I found that people are sensitive to things like potatoes and color, the common food stuff that we have. And therefore, what we've done, my portion of say, look here, do allergy testing, sensitive testing, all of which are very high, we're eliminating from the diet that gradually until we can come to a point. And some people benefit very well with that technique. And I think for that, though, is to exercise. Thank you, muscle.
Thank you.
Any more questions? Oh, well, thank you all for listening, and I hope you come away with some new information and new insights. And the students who are here and who are listening, you're going to go through you're going to report the next, the basic sciences, humanities, and this is where it all comes together. Yeah, I would say to persons that have been involved in anesthesia, intensive care, and all these other things, running new ICUs and stuff. To me, the most intellectually challenging thing I've done is to look at image, to understand interaction. It's easier for me to go and work the ICU and do something than to see a pain patient and try to work out great economics. And that's it. So bear that in mind when you see stories that I'm
Thank you so much, Dr. Ballin, for that very insightful presentation. I'm sure we all can agree that it was not only informative, but it really gave us something to think about. And now we'll ask Dr. Cham for the closing remarks.
Very, very good presentation. But there are two people who have been suffering from chronic pain share their experience, similarly icing on the cake. As someone who myself has suffered a lot of neck pain over recent years, I know exactly what, well, maybe not exact, but extent what I'm speaking of. There is a Japanese fellow, can't pronounce it here. His first name is Imati, I've never heard of it. He made a statement about pain. I found it very interesting. It says pain is like clouds on a rainy day, always passes. And then the question in my mind is, suppose it never passes. So we see what happens. Just doesn't go away. It actually wrecks your life. As we have seen with the first name here. But I also want to, from a Christian point of view, just also remind us of quote that C.S. Lewis made before he died. So that theologian, that 80s before he accepted the Lord, he said that pain is God's megaphone for a world that is deaf. Pain is God's megaphone for a world that is deaf. I would have said dead, but was his choice though. So there are many other quotes. In fact, I believe pain is a universal language. There's one thing I looked at this morning before Dr. Ballin came along, that in addition to the generalized severe cost to society that pain, chronic pain causes us, it is also well established now that if you have chronic pain, in addition to the things that so eloquently spoke about with Dr. Ballin himself, it is associated with a 20% increase having an acute MI. Chronic pain associated with a 20% increase of having an MI, a 30% increase having a severe stroke you may never recover from. So I thank Dr. Ballin, very insightful as Mr. said, but even much more than that, heart, rending and heart tongue. And I believe that is the correct. Thank you.